and welcome back to the fourth episode of the Naked Truth Show. Access to safe abortion is a human right and Saving Lives Matters series. My name is Kadau, and this series is brought to you under the flagship My Choice, Our Choice campaign, which is being rolled out by SAfAIDS, supported by Sweden under the Regional Transforming Lives program. The campaign seeks to contribute to a SADC region where adolescent girls and young women can access free from judgment, safe and legal abortion services. Abortion remains a highly contentious and debated issue despite the documented evidence on the impact of unsafe abortion on the lives of adolescent girls and young women, and the overall socio-economic development of our region due to policy restrictions. Today we're speaking about abortion as a public health issue and moving away from the conversation of moralizing abortion services. Joining us today is no stranger to the Naked Truth Show. We have the Director of Adult Rape Clinic, Ms. Memory Kadau, who's making a comeback to the Naked Truth Show. Memory, welcome back to the Naked Truth.
Thank you, Charmaine. Thank you for having me back at the Naked Truth Show.
So today we are discussing a very, a highly debated issue, despite all the evidence that we have, on the need to reform policies governing access to safe abortion, the issue still remains moralized. The moment you speak of abortion, people tend to talk about morality, but how can we move away from this narrative?
Very big and important question on morality. For me, I think having a conversation situated in morality is good, because I think it also then brings out the hypocrisy, the convenience that we are as a nation when we are discussing issues, especially when we are discussing essential services that are life-saving, like abortion. So how do we bring out the morality out of it? Probably not. We cannot, because as human beings, we engage on issues from different perspectives, sometimes with morality. But however, let's start talking about maybe how do we bring out that morality, or how do we address it? Let's talk about the reasons behind why in Zimbabwe, for example, there are high rates of unsafe abortions that are happening. We need to dig deep in terms of what's the reason that is happening, and our morality should be targeted towards that, and our conscience and our aggressiveness should be targeted towards that, why women and girls are conducting or are purchasing unsafe abortion services. So for me, I think if you look at a woman or a girl, if they have chosen to actually get an abortion, and most of the time it's unsafe because of the legislative environment in Zimbabwe, they must be really desperate. Because we hear a lot of horrid stories in terms of so many of those abortions do not end well. So they must be really desperate. So for me, I urge people to really, let's dig deep. Let's start talking about the reasons behind why women and girls are seeking unsafe abortions.
You spoke about the words essential service. I mean, in this time of the COVID-19 era, those are no longer new words. We are used to hearing them, essential services. There was a call by the World Health Organization for governments to acknowledge as well as make available reproductive health services, including access to safe abortion during the COVID-19 lockdowns. But the majority of SADC governments, including the government of Zimbabwe, did not heed this call. So how does this then affect our perceptions of safe abortion services as public health services?
It definitely does affirm, I think, the negative perceptions that people have in terms of access or the provision of safe abortion services as a public health issue. It also solidifies the issues around lack of political will, Because for us, the government, it's the government's responsibility to address challenges that we are facing in Zimbabwe. If you look at the evidence, if you trace it, and if you are concentrating very deeply, you actually see that we have a problem in Zimbabwe in terms of our high mortality rate. And I was also looking at statistics that 4 out of 10 pregnancies in Zimbabwe are unintended or unwanted, and 25% of those end up in those women seeking abortion services, and most of them are unsafe. So for me, I think the government response, not only Zimbabwe but in SADC, really is very concerning. It then solidifies these perceptions, these negative perceptions. And also, if you are looking at government commitments in terms of international commitments and regional conventions, for example, let's look at the Abuja Convention and the Maputo Protocol and the SADC Gender Protocol. These are the commitments that the government of Zimbabwe has an obligation to ensure that they are delivered, and women and girls are able to access sexual and reproductive health rights with minimum or without any impediments.
Okay. So from what you're talking about, or what the declarations and the commitments that you're making reference to, this is something that has been in existence for a very long time now, some of them for over 10 years. So what is currently missing then to ensure that we make that shift and we address access to safe abortion as public health?
Practical action. I think really practical action, because we make commitments that we are looking at the maternal mortality rate, if we dig deep in terms of abortion, abortion is the 4th cause of that high maternity mortality rate in Zimbabwe. So we need to really be practical in terms of addressing these challenges and honoring our commitments as a country. So the practical action starts with acknowledging that there is a problem that is happening, and how do we address it? How do we address the 25% of women and girls that are seeking unsafe or backyard abortions, which I think most of the time they then end up in the referral hospitals. In terms of development, when we started, we were talking about development of countries. In terms of development, it costs more for government or for the country to actually then respond to post-abortion care, because we are talking about the time that those women are going to be in the hospital, the medication, the people that are going to take care of them. Unless we had just provided safe abortion services to them, it's most likely going to cost less than when we are actually responding to a problem that has already happened. So for me, I think the practical actions need to be in place, and really acknowledging, we go back to the morality argument, when then it's okay for then a woman to then come in and then seek services, but we really are adamant, or we are moralistic around having candid and conversations around access to safe abortion services in Zimbabwe.
Thank you very much, Memory. Already you started talking about the socio-economic factors. This is something that we are going to discuss more in the second segment. Join us after the break. Welcome back, and thank you for joining us. Today we have Memory Kadau, the director of the Adult Rape Clinic, as we discuss access to safe abortion as a public health issue. Memory, welcome back.
Thank you.
So I know already you started to talk about, the cost of post-abortion care. So I want you to elaborate further for us, what's different would be made if we were to remove restrictive abortion laws and policies, particularly if we're looking at socio-economic impact.
So let's get to the figures. If we refer to the Guttmacher research, it talks about 224 somewhere there million US dollars are actually spent by governments per year to address post-abortion care. Then they also argue that only 20 million, government could spend only 20 million, which is, I don't know what fraction that will go into 223 million, by ensuring that women and girls access safe abortion services. So you can actually look at the difference, 223 and 20 million. Imagine where that money could go. That money could be distributed somewhere in terms of access to universal coverage of health, public health system, where we are talking about access to the COVID vaccines, we are talking about malaria, we are talking about TB, diabetes, and HIV in Zimbabwe. And recently, UK had made really huge cuts in terms of their contribution to the fight against HIV and AIDS. So you can imagine how much of that money can actually be put aside or be channeled to address the real challenges that we actually have in the health system. So if we're talking about, that's the money part is one, and then we are talking about the social, economic, and cultural implications. We are also talking about, young girls being able to reach their full potential. So if it's a nation, if we are all able to go to school, we know the implications when a young girl gets pregnant and is not able to access safe abortion services. It means they drop out of school. The cycle of poverty continues. So definitely you have more and more women and girls that are vulnerable, that are not financially independent, that are not contributing to the development of the country. Then if we are also talking about, access to reproductive health, sexual reproductive health services, which are generally a right. The medical implications bit part of it, which most of it is death. We are talking about the high mortality rates. We are talking about the death of women and girls. So for me, I think those are some of the social and cultural and economic implications that could actually be addressed if you ensure that safe abortion services are available everywhere, not only in Harare, but also in small cities and towns or remote areas where young girls could just walk into health service facilities and be able to access those services.
When we are talking about access to services, as you're mentioning now, and we know currently, not just in Zimbabwe, but across the SADC region, there are several circumstances under which access to safe abortion is legally permissible. But what can SADC member states do to strengthen access to these services to ensure that we do not have gaps when we have the removal of the restrictive policies?
Okay, let me come to Zimbabwe before we get into the SADC region. Our work at Adult Rape Clinic is to provide services, medical legal services to survivors of sexual violence. And a component of that work also involves facilitation of women and girls to access safe abortion services within the Termination of Pregnancy Act. So I like the fact that we were talking about policy and what Zimbabwe can do and other SADC countries can do so that, there are no restrictions or barriers. If you're looking at the Termination of Pregnancy Act in Zimbabwe, and I know it's, we also did a comparative study, it's also almost similar with other SADC countries where it's really restrictive. The act is there, but it's not really, playing its role. And if you ask anyone on the streets of Zimbabwe that are just walking by, is abortion legal or illegal? They'll tell you it's illegal. which is, well, not really true. It's restricted. So even in it being restricted, and rape is one of the provisions where women are eligible, rape and incest are eligible to access safe abortion services. The process is just cumbersome. It's tedious. You need third-party consent you go to the hospital, the doctor has to approve, you go back to the police. After the police, you have to go to the courts have to approve, then you have to then come to the hospital to access those services. So you can imagine this is a woman or a girl that has been raped, that clearly does not want, the pregnancy. So you can imagine the psychological and physical trauma that they are going through and the tedious process that they actually have to go through for them to actually get that third-party consent. So for me, I think what governments, and particularly the government of Zimbabwe, can do is to actually reform the law. Remove these administrative barriers to ensure that women that are eligible can access the abortion services. And the other issue that we are also even pushing for was, can the midwives and, or nurses, especially midwives, be able to also perform these abortion services? So for me, I think it's the restrictive administrative barriers, and also it's the awareness part. People knowing that this is the legislative environment. In Zimbabwe, people don't even know, so they cannot access those services.
Thank you very much, Memory. Public health is a guaranteed right, or should be a guaranteed right in every country, and safe abortion services are also essential public health services. Join us in the third segment as we continue with this conversation.
As political leaders and policymakers, it's our responsibility to do what's right for our citizens, to provide for their health and well-being, while also ensuring our countries prosper economically. Making abortion legal and accessible improves the lives of our communities by reducing maternal mortality and morbidity, keeping girls in school, and increasing sexual and reproductive health outcomes, and is also wise economic policy. That's because without access to safe abortion services, due to restrictive policies, unsafe abortions will happen. These are dangerous, even deadly, and are very costly. In fact, the cost of providing safe abortions is estimated to be less than 1/10 of the cost of caring for women after unsafe abortions. Loss of income and the potential costs of recovery can cause major financial burden to families, communities, and healthcare systems. Putting policies into place that expand access to safe abortion is a proven way to lower healthcare costs, reduce maternal deaths, and achieve sustainable development goals. Your country can save the lives of adolescent girls and young women by improving access to safe abortion through legal and policy change, in line with regional strategies and international development priorities. Learn more about how to save lives and unnecessary spending through improving access to reproductive health care at SAfAIDS.net. My choice, our choice.
Welcome back to our third and final segment as we are discussing access to safe abortion as a public health issue. Memory, welcome back to the third segment. So how can we motivate, societies to create a conducive social cultural environment that responds well or supports the conducive policy environment that we're calling for, particularly when we're looking at, the policymakers, the health service providers, and the other leaders that we're engaging coming from those same communities that are moralizing access to safe abortion?
Inclusion is the key word. We need to go and speak to communities, make them understand why safe abortion services are essential and why they're important for women and girls and for the development of the country. And let's be really practical about this. If we talk about communities, we go to your chiefs, your sabukus, And you start talking to them about, we talked about the moral argument. There are so many women that we assisted at our rape clinic that need safe abortion services in cases of rape, in cases of incest. So if you want to be moralistic about this, a woman that has been raped and gotten pregnant and needs safe abortion services, well, it's their right to access them. And in terms of incest, what does even our cultural values say about raising a kid born out of, incest? So for me, I think the inclusion is really important. Go back to communities and make them understand why we need policies that are responsive to the needs of women and girls, of what's happening on the ground. Because most of the time we support things that we understand. We really, well, we argue or we don't support things that either fearful of or we do not understand. So for me, we need to have these conversations and really share this evidence that we have around women and girls dying, backyard and safe abortion services, and their implications on societies and communities, so that they understand if women and girls access safe abortion services, it's good for communities, it's good for societies, and it's also even good for our public health system.
So just related to that now, lastly, what would be your call to action, to our policymakers and our leaders, in Zimbabwe, in the SADC region and beyond?
For me, the first one is the political will, practical action around honoring their commitments, funding being channeled to ensuring that safe abortion services are accessible and are decentralized. Service providers are trained, they have the right knowledge and perception for them to perform their duties. Then also, I think we've been talking about the administrative and restrictive barriers for quite a long time. And I like the conversations that are happening at the moment around access to safe abortion. We need to accelerate that. We need to move from just having talk show conversations or conference conversations to actually implementing that, because, well, we have set achievement for Agenda 2030. We need to actually be having a roadmap in terms of how do we get there, how do we decrease our maternity mortality rate, how do we ensure that women and girls are accessing quality health care services in their communities, regardless of where they are located and how much money they have.
Thank you very much, Memory, for joining us today and for that very strong, call to action. We need to ensure that women and girls are accessing quality, safe abortion services as a public health right. Thank you for joining us. Access to safe abortion is not and should not be about morality or measure of one's character, or access to safe abortion is an integral part of a fully functioning public health system. Join the campaign. This has been the Naked Truth Show, Access to Safe Abortion as a Human Right and Saving Lives Matters series, brought to you by SAfAIDS in collaboration with Bayete Development Institute under the flagship My Choice, Our Choice campaign, which is generously supported by Sweden under the Regional Transforming Lives program. Join the campaign, support choice. Goodbye.